Just as many parents have long suspected, the World Health Organization now says that the 2.6 billion people around the world who play video games could be putting their health at risk. The group announced this morning that compulsive gaming now qualifies as a disease. The good news is that only a minority of these gamers are likely suffering from such a health condition. Still, the WHO's news release will surely confirm the fears of many critics who have worried for years about the addictive and damaging aspects of repetitive game playing, especially by young people. The UN Health Agency said classifying gaming disorder as a separate condition will serve a public health purpose for countries to be better prepared to identify this issue. The huge global gaming crowd, which includes two-thirds of American households according to the Entertainment Software Association, spawns annual revenues for the industry that are expected to grow 31% to $180.1 billion globally within the next 3 years. Consider this: Fortnite, the latest blockbuster created by Epic Games that pits players against each other in an apocalyptic storm, reportedly earned $300 million in a single month recently and has drawn more than 100 million players. Dr. Shekhar Saxena, director of WHO's Department for Mental Health, said WHO accepted the proposal that gaming disorder should be listed as a new problem based on scientific evidence, in addition to the need and the demand for treatment in many parts of the world. Scientists, however, cautioned that only a small number of gamers would be affected by the disorder. Some experts even said that the new designation could cause unnecessary worries among parents. With the help of the WHO and other groups, here are some of the things you should know about the newly classified disorder and what to do about it. What is a gaming disorder? According to the WHO's latest classification, a gaming disorder is defined as a pattern of gaming behavior, digital gaming, or video gaming, characterized by impaired control over gaming, increasing priority given to gaming over other activities to the extent that good gaming takes precedence over other interests and daily activities, and continuation or escalation of gaming despite the occurrence of negative consequences. How is it diagnosed? A diagnosis requires a behavioral pattern of sufficient severity to result in significant impairment in personal, family, social, educational, occupational or other important areas of functioning. These symptoms would also have to be evident for at least 1 year. What is the International Classification of Diseases? The new gaming disorder is listed on the WHO's International Classification of Diseases, or ICD. This list is used to track health trends and statistics around the world, and it sets an international standard for reporting diseases and health conditions. It's used by doctors and researchers to both diagnose and categorize conditions. How does something like gaming disorder get onto the list of diseases? The decision by WHO officials to add the disorder is based on reviews of available evidence and reflects a consensus of experts from different disciplines and geographical regions that were involved in the process, says the WHO. The inclusion of gaming disorder in ICD-11 follows the development of treatment programs for people with health conditions identical to those characteristic of gaming disorder in many parts of the world, and will result in the increased attention of health professionals to the risks of development of this disorder and, accordingly, to relevant prevention and treatment measures. How many gamers are suspected of having this disease? The organization says gaming disorder affects only a small portion of people who engage in digital or video gaming activities. However, says the WHO, people who partake in gaming should be alert to the amount of time they spend on gaming activities, particularly when it is to the exclusion of other daily activities, as well as to any changes in their physical or psychological health and social functioning that could be attributed to their gaming behavior. In other words, not everyone who plays video games is sick. That's right. Dr. Joan Harvey, a spokeswoman for the British Psychological Society, said that only a minority of gamers would be affected by the disorder. People need to understand this doesn't mean every child who spends hours in their room playing games is an addict, she said. Otherwise, medics are going to be flooded with requests for help. Is there a particular group of people who are more prone to being diagnosed with this disease? WHO officials say the new classification is critical to identifying video game addicts quickly because they are usually teenagers or young adults who don't tend to seek help on their own. We come across parents who are distraught, not only because they're seeing their child drop out of school, but because they're seeing an entire family structure fall apart, said Dr. Henrietta Bowden-Jones, a spokeswoman for behavioral addictions at Britain's Royal College of Psychiatrists, told CNN.